Hi, and welcome to the second episode of TILLY, the Interactive Lupus Link for you, brought to you by the Lupus Foundation of New England. I'm your host, Marisa Zeppieri-Caruana. Some of you might already know me as LupusChick, and I just wanted to say I'm once again thrilled to partner with Beverly and the entire Lupus Foundation of New England community. Today's episode on lupus nephritis is co-sponsored by Aurinia Pharmaceuticals and also Exogen.com. I have an amazing rheumatologist that I want all of you to meet, Dr. Maggie Cadet. She is a rheumatologist in the New York City area, and she's going to tell us a little bit today about lupus nephritis. But before we start there, Dr. Maggie, that's what I usually call you, can you tell us a little bit about yourself, where you practice, your experience, your education, just something that you want the viewers to know?
Thank you, Marisa. I'm so honored to be here. I find lupus so fascinating and it's such a passion of mine. I began my rheumatology journey at NYU, Hospital for Joint Diseases. That's where I did my fellowship training. I actually became really interested in lupus when I was doing my residency at Yale New Haven Hospital in Connecticut and found so many lupus patients there and wanted to really dedicate my life to educating women about autoimmune diseases, specifically lupus. Since my medical journey, I have been practicing at academic hospitals where research, clinical, and basic science research is really important, but I've also found working in the private clinical setting very rewarding as well, because it's all about patient care and really interacting with lupus patients really intimately. So I've done the whole gamut, and I've also been involved with teaching medical students and residents, which is where the interest in rheumatology started for me as well.
Oh, thank you so much for that intro. So I specifically wanted to have you on today for the lupus nephritis episode because I know it's an area that you deal with, that you've done a lot of work in. You actually educated me that there are different types of lupus nephritis. So I wanted to ask you, when you have patients that come in with lupus, what are the symptoms that they're typically presenting with that make you think there might be kidney involvement? And for the viewers that aren't aware, can you tell us what the different types of lupus nephritis there are?
Yes, absolutely. So for every lupus patient that I take care of, I'm always monitoring for lupus nephritis because about 60% of lupus patients will develop nephritis. So it's something we have to really be on the lookout for. So some of the things I will ask patients about is change in weight, because there is, weight gain in the ankles. There could be facial swelling. There could be leg swelling. Also, I'll ask them if they have noticed hypertension. So, whenever they go visit their primary care doctors or me, we always take a blood pressure. And if there's a rise in blood pressure suddenly or gradually, that's something to take note of. Other things could be foamy or frothy urine. This will happen when there's a lot of protein in the urine. Also, some patients may develop dark urine or actual blood in the urine. And that is a really important sign that some kidney problem may be occurring as well. So those are the main things that I look at when I'm thinking about kidney nephritis syndromes. Now, in terms of lupus nephritis, there's other things we have to also look out for. So we now know that African Americans, Latins, Americans, Hispanics, also Asian Americans have a higher risk of developing lupus nephritis more than Caucasian women. So again, whenever we're looking at patients, we look at the race as well as gender. Now, in terms of lupus nephritis, there's actually 6 classifications of lupus nephritis. I won't go into them in detail, but I'll at least name all of them. One is minimal mesangial. Mesangial proliferation is the second one. 3 is focal glomerulonephritis. 4 is diffuse glomerulonephritis. Class 5 is membranous glomerulonephritis, and class 6 is advanced sclerosing glomerulonephritis. With nephritis, what happens is, we all know that in lupus, we have autoantibodies or proteins that attack the body, and in this case, it attacks the kidneys. What happens is these autoantibodies actually attack a part of the kidney called the glomerulus that's involved with filtering the toxins of removing waste from the kidney. And within the glomerulus, which is a tiny tubular structure where blood flow is seen, there are also mesangial cells that are affected. And again, these all help filter the kidney. So when there is inflammation of the kidneys from the autoantibodies, the glomeruli also become inflamed. And that's what causes nephritis and leakage of protein as a result of the inflammation.
Well, thank you so much for going into that. I know about lupus nephritis, but I wasn't really aware of the different classifications that someone can have. So let me ask you, if you are working with a patient and their labs and their symptoms come back that there is kidney involvement, what does treatment typically look like for patients, whether it's medication? When does dialysis come into the picture, or a kidney transplant, or things like that?
Yes. So once we are suspecting lupus nephritis, the rheumatologist will do blood work. So we look at the creatinine, which is a measure of the kidney function. We will also most likely get an ultrasound or CAT scan of the kidney to see if there's any abnormalities in the kidneys. But everyone should get a kidney biopsy for the most part, especially if we are suspecting real kidney damage, which can be evidenced by a lot of spatial swelling, leg swelling, a lot of protein in the urine from a urinalysis or blood. So a kidney biopsy is the gold standard and will tell you exactly what type of kidney disease you will have in terms of the classification system. Once we determine the classification system or stage of kidney damage, then we can tailor the treatment. What does treatment look like? It depends on the classifications of glomerulonephritis. So class 4, the diffuse proliferative glomerulonephritis, is probably the most worrisome, and it is evidenced by a lot of blood or hematuria or proteinuria in the urine. This will constitute treatment as steroids, high-dose steroids, and an immunosuppressant, which I'll get into soon. Class 5 is membranous. This will look like a lot of protein, a lot of swelling. Sometimes patients can also develop blood clots in the kidney as well as other parts of the body. So we're worried about that as well. Class 6 is the sclerosing glomerulonephritis, and that means there's scarring. So whenever there's scarring in the kidneys, that can lead to progressive renal failure or kidney failure, and that may require dialysis. So again, depending on the type of glomerulonephritis, will tell you how much kidney damage will progress. But class 6, the scarring one, will lead to dialysis. Now, in terms of treatment, most of the time, class 2, 3, 4 and 5 will require steroids. The class 4 and 5, the most serious ones, will require high-dose steroids and an immunosuppressants. We have a lot of immunosuppressants now. There are drugs called azathioprine, which is one immunosuppressant. There is Cytoxan, which is the chemotherapy agent that's used for class 4 and serious kidney problems. There's also Celsip or mycophenolate mofetil, which has also been used. There's Benlysta. Last year in 2019, there were trials looking at Benlysta or belimumab in kidney disease in lupus patients, and they're promising results with that. There's also rituximab, another monoclonal antibody that can help decrease the amount of B cells that cause the autoantibody production, and that's also been used. And Plaquenil is not necessarily used for the lupus nephritis, but it's used to control lupus, so that way you may not develop lupus nephritis. So we do have options out there for drug therapy for lupus nephritis, but 10 to 30% of patients with lupus nephritis will progress to renal failure and dialysis. So it's something we really have to target and get control of.
So when someone actually progresses to the point where dialysis is involved, is that a long-term solution, or is that a solution until there's a transplant?
Absolutely correct. Yes. So we all know the celebrity Selena Gomez, and she speaks openly about her renal transplant she had a few years ago. she was lucky enough to find a match, and she went straight to getting a kidney transplant. But not everyone is as fortunate and may require dialysis first. If they require dialysis, it could be a temporary measure. It could be a long-term measure. What we do tell patients as well is there are lifestyle risk modification that can happen. So you want to have a diet that's low in sodium as well as low in protein. You want patients to stay hydrated because, again, the kidney is the area where waste and toxins are filtered out and removed. You also want to control your blood pressure. So medications like ACE inhibitors or angiotensin receptor blockers, they all help control with blood pressure, but they also help with the kidney inflammation and helps decrease the inflammation and also helps maintain the blood pressure. There's other blood pressure medications like diuretics that can help with getting some of the water away from these patients. So diuretics are used as well. There's calcium channel blockers that's used for high blood pressure. Other things we want to do is, again, get moving, exercise. You want to control your cholesterol level because, again, those are risk factors for hypertension, and also with membranous nephritis, where you get a lot of protein, high cholesterol sometimes is seen as well. So there are lifestyle modifications that patients can also do. It's not a cure, but again, these are things that we can do. There's also one more point I want to make in terms of the treatment. Cytoxin was used a lot in the past, but Cytoxin has side effects, especially for older patients. They may get bladder infections or hemorrhagic cystitis. There could be ovarian failure, so people can go into premature menopause, infections, malignancy, bladder cancer. So right now, mycophenolate mofetil has been shown to actually be as equivalent in use in the terms of using it in nephritis, and a lot of African Americans and Latinos do respond better. So again, looking at your race is important in terms of treatment, and just knowing that there are multiple treatment options out there is important.
That's amazing. You have so much information. Thank you so much for sharing all of that with us. So obviously, from what you're telling us, there are multiple treatment options.
Yes.
And if you can just share with our viewers, if they're currently being tested for lupus nephritis, maybe they're going through the kidney biopsy or things like that, and or if they were recently diagnosed of having kidney involvement, can you just share a little bit about just expectancy and quality of life, and just something to inspire them, encourage them that even with major organ involvement, that you know, it isn't necessarily like this, I don't want to say death sentence, but you know, like I feel like sometimes that's a word that we hear with lupus, right? We know that even though the percentage is small, there are people that do pass away from different complications. You were explaining the other day to me that I believe it was the heart involvement was the #1 cause of death. And you can share with viewers if you want to go into a little bit about that too. But I really think coming from a physician, just some words of encouragement and like inspiration, so they know that there are medications out there and they can still enjoy their life even with, you know, kidney involvement.
Yes, it's a great point. I think now we know so much about lupus, and we're getting the information out there, and we're also encouraging our patients to be advocates for themselves and be educated. The key to lupus is really early diagnosis and early treatment, because there are a lot of patients who do sometimes are hesitant to start medications, and I understand their fear because there are side effects and there could be infection risk. But what we want to do is prevent life-threatening complications, such as the heart disease as well as the nephritis. So even though these are worrisome complications of lupus, just know that there are medications out there. You know, a few years ago, we didn't have all these options. Now we have 4 or 5, you know, medications are possible treatments for lupus nephritis. We know that belimumab is a newer medication that was FDA approved several years ago, and that's being looked at for lupus nephritis, as well as controlling moderate lupus as well, and mild lupus. So know that you can have a good quality of life, but you do have to modify your risk factors. You can't smoke. You have to really, really control your diet, limit your sodium intake. That's for kidney and for cardiovascular risk prevention. You have to control your blood pressure. You have to control your weight. Obesity is a risk factor, again, for both diseases. Get moving, stay active, even though I know it's hard, but again, we talked about this the other day, just being able to take, 30 steps, back and forth around your home, around your block. It makes a difference as a cumulative effect. So know that there are options out there, treatment options. There are studies going on all the time in the field of rheumatology and immunology now. We have all these targets for lupus. We have, autoantibodies that we're targeting, other cytokines and chemicals that we're targeting. The research is out there. We just are waiting for the results of these trials. And just know that you can live a productive life, but early diagnosis is key. Getting a kidney biopsy is necessary, I feel, in most cases, and starting treatment aggressively to get into remission, to prevent relapse of remission if you get there, and to prevent kidney damage from continuing if you do have it.
Wow, well, thank you. That was so much information. It was so helpful. I know that our viewers are going to fall in love with you just as much as I have. And so for anyone that's near the New York City area, that's where Dr. Maggie Cadet is located. But I also want to give viewers an opportunity to follow you because you do a lot of Instagram lives. You're posting all the time. I just feel like you're such an approachable physician, which is really nice. And I think that that's something that patients really need because sometimes we feel like we can't have that close of a relationship with physicians, but we want that, we want to be involved, right? So let everyone know about your website and about your social media accounts so that they can follow you.
Yes, so I do have my own personal website, www.maggiecadet.com. I post a lot about different autoimmune diseases, but since May is Lupus Awareness Month, I'm really focusing on the different complications of lupus and how to live a better life and also to have a good relationship with your physician. And on Instagram, it's Dr. Maggie Cadet. That's it. So I'm going to keep posting all month. And again, this is something that I'm passionate about. I'm so grateful to be a female physician. So a lot of my lupus patients do relate to me. I am an African-American physician. So again, because lupus does affect so many minority women, it really is important for me, again, to have them feel comfortable speaking to me about their disease. And I'm here for men too. So I hope people will reach out, and I hope, I'm going to continue my goal in educating men and women out there about lupus and trying to have them make their best lives count and a reality.
Well, thank you. I love following you. I love that you bring so much awareness and support to patients that deal with all different types of rheumatological issues, and you've been a huge help to me. So I definitely want to have you on TILLY again because you're a wealth of information. So thank you for being on our lupus nephritis episode. I will post all of Dr. Maggie's contact information and ways that you can follow her at the end of this video. And again, thank you so much for being here.
Thank you.
I want to introduce you to a friend of mine, Mexican television host Erika Kaiser. Erika is going to share her amazing story of getting a kidney transplant, everything that she had to go through to try to get that transplant. She didn't have insurance. And also how after that transplant, she was actually able to compete and become a winner in the World Transplant Games. So she's going to tell you all about that if you're not familiar with those. I wasn't at first, but it's an incredible story and she has so much to share with you. So Erika, I just want to thank you so much for being here with us today. And if you can, tell our viewers a little bit about your life in Mexico, what you do, and how you first found out that you actually had lupus.
Hi, Marisa. Thank you so much for having me. I am Erika Kaiser. I am from Mexico City. I got lupus and I had a kidney transplant. I am a TV host here in Mexico. I am a speaker and I am a champion of the World Transplant Games at triathlon. I got my kidney transplant thanks to one of my dearest friends, now my sister Gabby. She gave it to me 5 years ago. And I am so blessed to share my story and to help other people with this. That's why I'm a speaker. And that's why I have that type of mission, you know? I think that this story could be just for me. And I know that maybe it could help a lot of people.
Oh, thank you so much. Absolutely. So let me ask you, before you had the kidney transplant, what were you thinking when you were first told that you had lupus nephritis? What type of emotions were you going through? What was that process like before you actually had the kidney transplant take place?
First of all, I didn't hear about the word lupus in my life. So when you realize that you have this type of illness, and what is that? And what is going to be? And what is this? You know, I used to have a very, very healthy lifestyle since I was a kid. I was always on a diet because I used to be a professional ballerina. And my mother was a professional ballerina too. And she's the master of some schools. So I got like a sergeant in my house since I was little, you know. So this topic of discipline, of working out, of diet, it could be like I was a very, very, very healthy lifestyle. So you are not going to think there's no a moment that you are going to think that you have an illness. So when they told me that I had lupus and I had this nephritis, they told me you got only 2 months to live. And when you are in your 20s, you're like, you don't know how to deal with that, you know? But I had very clear something. There was like 2 scenarios for me. Like, I have to be like a doll without sun, like in a crystal box, without sun, without sodium, without a lot of emotions. And I don't know, maybe spend 10 years, but 10 years not being myself, not being Erika. Or being Erika, like 1 year, but doing the things that I wanted to do. The thing that I am telling you is that you can notice that the doctors told me, you just have 2 months of life. And the first thing that I did was, no, I need more time. And this could be my reality, you know, even though I am very aware of my illness and my condition, my thought was like, I don't have time to this because I have to do a lot of things in my life. So for people around me, it was very difficult because they were telling me that I was going to die. And in every single consult, I was asking the same 2 questions. When I'm going to be a mother and when I'm going to be able to back to dance. So people were like, Erika, they are telling you that you are going to die in 2 months, that you have very, very chronic, very important chronic illness, and that your kidney function is like the worst in the world. So I was like, no, you know, it's like difficult maybe to express because I was aware of that, but I can't accept it like that and say to me, now you are sick, now you are going to die, it was like, I don't have time to do this because I need to do more stuff. So I don't know if I was like a little bit like prepared to this because of my life, because of another experiences I had been through. Like I was very with this thought very, very certain in my mind that you're not going to die. You should decide to live in the best way you can do it. Even though you have this. What do you can do about it? What is in your hands and in your power to do this and to deal with this? So at the first time, of course, it was like shocking, but at the same time, I have to take a decision, and I have to be like, okay, I have this, what I have to do. And the first thing that I started doing, it was taking information and trying to know much more about the illness, about the medication, about the food, about every single thing that can improve my wellness, you know?
So we can see with your story that all of a sudden you're sort of handed this diagnosis, and obviously you had severe disease activity going on, and a physician tells you that you have 2 months left, and that's obviously a lot to take in all at once. And now you have to start making all of these decisions, right? You have to decide what you're going to do as far as medication, what's going to happen, right? How you can try to battle this. So I'm curious, you mentioned Gabby. I want to know, where does Gabby come into all of this, and how did that happen? Because she's actually the one that gave you her kidney. So can you tell us a little bit about what happened next?
It was very, I don't know how to say it, because first of all, lupus is a chronic invisible illness. So even though I didn't have the symptoms, because I didn't have them, I used to do a lot of workout in that time of my life. And I was in a very stressful environment, because I was studying 2 careers at the same time. I was working at the same time. I was with my heart broken for a boyfriend. So it was a lot, you know? But I started gaining weight when I used to be very skinny all my life, because of the dancing, because of the workout and so on. And because of my work, because when I started on the TV and in the theater when I was 3 years old. So it was very rough for me, you know, when I started gaining this, when I started, my body starts to change, but only because I was gaining weight. So people start like, oh, you're gaining weight because you are so stressed, because you are so sad, because. And the last thing that you're gonna think that is that you are sick. So when they told me about the diagnosis, and people start looking at me differently because of the treatment, because the treatment was the cause that I started looking different. So I lost a lot of weight. I was very, very skinny, but with this famous face of the prednisone, you know? Like, so do you know the dolls Bratz?
No.
They are very, very skinny dolls, like models, but they have the head like this. And Gabby and everyone was like, oh, the Bratz doll, you know? They're like the model, but with this type of face. So Gabby was living in Playa del Carmen at that time. And one day she called me and she told me, I just found out that you are sick. I'm going to Mexico next week. I want to see you. Okay. So now in the interviews with Gabby, when they ask her about what about the story, she always say, for me it was very shocking seeing Erika like that, because I have in my mind Erika is like strong, like a big woman, like with a lot of presence. And when I saw her, she was very tiny, like weak, like, you know. So for her was very shocking. And she started taking care of me. She got a business of fruit and groceries, fruit and vegetables. She works a lot, and every single week I got a box full of vegetables, full of fruit. You know, she was my friend that she was there. And when I was want to go out, she was going to my house to take me to that place. You know, like she was a friend that she was very close to me when I was through this.
Right.
But even though we didn't think that this, okay, that part is one part. Another is to think that Gabby was going to give me her kidney, because it was like, first when I was 20 years, it was the diagnosis, but the transplant went when I was 25 years.
Okay. So she winds up being a match, which is incredible, because I know a lot of people that are waiting for a kidney, and even their own family members aren't the right match, so that, you know, they're still waiting. So you go through this process, and so what is that like when you're both in the hospital, and what was that experience like?
Okay, well, first, doctors start telling me, Erika, you would need a transplant soon. And I was like, okay. Erika, you would need a transplant. Okay. Because my thought was like, if I am feeling good, why I am going to need a transplant? If I am feeling right, why I'm going to go to dialysis? You know, I'm very stubborn in that part. So I was like, yes. But at the end, they told me your function is changing too much, your creatinine and so on. So we have to see what is going to happen, and you should be thinking about dialysis. And at the first time, I was like, of course not. I am not going through hemodialysis or dialysis because I can be attached to a machine. I can't, because I'm a very active woman. It's like my mind was like that. So, okay, I need a transplant. Okay, let's go. We should do my transplant. And people was like, okay, take it easy. It's a rough and a large path to go to get a transplant. So first of all, I don't have an insurance here. So it's very difficult. No, the money, all that stuff, it's like too much. Then, of course, the most important thing, the kidney, that you have to be compatible with someone. So because of my clinical condition and all the context, it was not like a typical kidney transplant because I got lupus. So first, when you're talking about a transplant, the first thing that you're going to think about is your family, right? If you need one, you're going to go to your family. Right. My parents wasn't the best option because of the difference of age. No, it was better to have someone that it was very close to my age. Right. That's the thing. So my brother said, no, I don't want to give her my kidney, because he was so afraid about it. My sister, she said, yes, but she was 17. So she is not allowed to give me and to start all the tests to see if she was compatible. So when I was in this time, I was very in a rush because I didn't want to go to hemodialysis, you know? My rush and my time was like, I don't want to go to dialysis, so I need a transplant now. I need a transplant. So we should, it was like the doctors like, oh my God, Erika, take it easy. You should do whatever it's good for you, not whatever you want to do. So I start talking with my people, with my friends, and one day I was at the living room of my house with my sister, with Gabby, my friend, and I was telling her, I can't believe it. My cousins, 2 of them told me that they can do it, but they don't have the type of the blood type. And the other one had the blood type, but he had an infection like 8 years ago before that, you know, but for that reason, it was impossible. So I was telling that with Gabby and my sister, talking very casual. And I was like, and she asked me, what type of blood do you have? And I was like, positive O. I don't know if you say it like that in America, and she was like, oh, I have that. And Maria say, oh, you should do the test. And Gabby, yes, I should do it. Just like that.
Wow.
And for me, it was like, I am going to take this moment. It doesn't matter if it will be okay, if we are going to be compatible or not. I take this, and I'm going to take this moment to say, this friend of mine, she really loves me. She really take care of me, saying that she is going to be able to do it. So we start. So it was a little bit difficult when I realized and the doctor said to us that Gabby was compatible with me. I talked to her and I said, oh my God, you are not going to believe it. We are compatible. We can do this. So I was so happy, you know, I was so blessed, because sometimes even when you have a father that he wants to give you a kidney, it can be possible. Imagine that my friend, she's my friend, and now she's like my sister, and she was able to put herself into that.
Well, Gabby sounds absolutely amazing, and we already know that you're amazing. And you know, I love your story because, like I mentioned before, there are people right now who are on the transplant list, or who are having family members and friends being tested. And you know, I feel like they can draw a lot of inspiration from your story, because sometimes it may not be a family member who's a perfect match. Maybe their blood type might match, but for whatever reason, either the age difference, or maybe they have an underlying medical condition that somewhat takes them out of the equation. So I think looking at your story and knowing you had some incredible hurdles that you had to overcome. First, you had to obviously find someone who was compatible. And then two, you didn't have health insurance. So I know that you went on this, you know, fundraiser, advocacy, awareness sort of expedition to try to raise funds, because now you obviously had to get a major surgery. So I feel like that could be very inspiring for other people who are right now where you were years ago. So, you know, I want to ask you, what is your life like today? You're 5 years out from having the transplant, and every time I see you online and I watch what you're doing, you're sort of like the Energizer Bunny. So I'm curious, 5 years later, can you tell our viewers, what is your life like today?
And I just wanted to, before we wrap up, tell people about these World Transplant Games, because I was not familiar with them. So I went and looked them up. So I wanted to learn more about it. So for people that are not familiar, tell us what that is and what that experience was like.
It was amazing. Amazing. You don't have any idea, because like you, I didn't heard about it in nowhere. Come on, what? When they said to me, you should go to the World Transplant Games. What? What is that? You know? And even though it has been like two times I have been there, and I was on the TV talking about it all year long, trying to do awareness about it, people doesn't know about this. But it's like the Olympic Games for transplant people with kidney, liver, whatever. They are there, and they have a lot of categories. They have like, you can do golf, tennis, triathlon, swim, running, whatever, arch, everything.
That's awesome.
So for me, this happens because of the campaign Erika Quiere Vivir. I got a community of people with lupus, with kidney transplants, with failure, everything, you know, that people went like a community to me in social networks. So it was a lot of people that was throwing this my story, and they were, hi, I'm from Spain, I got the same. Hi, good. What do you take for sleeping? You don't look like you have lupus, but I have it. Yes, you know. And you start talking with people, and you start knowing people from other parts of the world. So I made a huge community of these type of persons, And we start talking, and I think it's very important to do it because you can have a different perspective of all your process. So one of them told me, Erika, you should come to Spain to the World Transplant Games. To the what? Of course, I was telling you that I have been working out all my life and dancing and Pilates and kickboxing, but you're not going to think triathlon. So I was like, okay, what I'm going to do? If you have a dance part, of course. And he was like, no, this is like Olympic. Yes, okay. If they don't have dance category, I will make a dance category. And they were like, it was like, first of all, we are laughing about it. But then I realized, and I was talking with I used to do indoor cycling in that time. So I went to my coaches and I asked them, how do you think about this? They are asking me to go to the World Transplant Games and maybe I can run. I can run, right? And they were like, come on, Erika, you're going to get bored. You really? So it was my coach talking to me, saying to me, of course you can do it, And I was like, but this is not, I'm telling you, I was doing cycling indoor for normal people. And they were like, of course, you're going to get bored if you're going to run. Tell me, what more is it? Okay, triathlon is the most difficult. Yes, I was like, of course, I want to do the most difficult part of the triathlon and of the competition. No? So I decided, because in my mind was, I am going to know all these people, to know the people that has been writing to me, has been close to me through this path. Of course, I wanted to do it. The last thing that I was thinking about that I was going to win, it was for me, it would be amazing to know these people that is with me since a lot of time. So I started to train myself in 2 months. Wow. Just swimming, eating, sleeping, swimming, running, cycling, every single time, every single day. And then I went, my first games were at Spain, at Malaga. They were amazing. You don't have any idea, because it's a lot of empathy. You are on the airport, you don't know anyone, but at the first time they saw you with the uniform of the World Transplant Games, they see like, oh my God, hi, where do you come from? And a hug and kisses, that was like amazing. For me, it's not about the medals. For me, it's not about that. For me, it's the being so blessed to know these people, that all of them are winners. Because it doesn't matter if they have a medal or not. They are there. They are alive. They had a second chance to live. And they are living the best way they can, because they are athletes. Right. It's amazing. You don't have any idea. You don't have any idea how to feel that when you think that it's the same. They were telling me, you are going to die, and I am not dead. They told me, you can't, but I can. Even though now I have here a scar, even though but I'm here. I am so blessed to do that. You were telling me about the support system and about what people think about this. But the first thing we have to do is, what do you think about yourself? What do you think about your illness? It doesn't matter what people act about the illness. How do you act about your illness? How do you accept it? Because you have to accept it, because it will be very difficult to someone else to accept it if you are not the one and the first person that accept your reality. This is your reality. So take it and love it and try to do it, even though sometimes it hurts. Sometimes it's very difficult because you don't have energy. But you have to think, I have this, because I can with this and I can deal with this.
You are so sweet. I am so grateful, and we are so blessed to have had you on for our second episode of Tilly on the topic of lupus nephritis. So I just want to thank you so much for sharing your story of hope. I hope that it has inspired and encouraged our viewers. And I just want to let everyone know I will be sharing all of her information here so that you can follow her. And I just want to thank you for tuning in to the second episode of Tilly. And I hope that you'll stay tuned. We have another great episode coming next week. And I just want to thank you again, Erika. So have a great day, everyone, and take care.